is with us live. Raywat, thanks for your time. The data coming out now just showing how much the Delta variant has taken over in this country. And I gather everything flows from that Delta variant. As we see stiffer restrictions going in many Canadian provinces, tomorrow, the Ontario government starts its vaccine passport, and the hopes there it'll boost immunization rates. And I gather it already has.
Yeah, every time a vaccine passport or whatever you want to call it is announced in a given province or country, the very next day the bookings for first shots increases dramatically up to 200%. So it works. Make no mistake, it works.
So where are we in fighting Delta and trying to bring these rates down, especially in Saskatchewan and Alberta, so it doesn't start spreading or growing even more so?
Well, it's still a problem in those provinces, obviously. It's almost entirely an Alberta problem right now in terms of deaths and hospitalizations in Canada. So what do you got to do? Of course, you get vaccination rates as high as you possibly can in the short run. However, that won't account or change the fact that we already have an overloaded hospital system in those provinces. So those cases must be resolved before we see some semblance of normal. The vaccination rates will prevent additional burdens on the healthcare system, but won't solve the ones currently there.
Lockdowns, that hasn't been part of the vocabulary going into or during the fourth wave. Should it be?
I don't think it should, because we can avoid it. This is entirely a human problem now. Before the virus, we didn't understand it. It had its way with us. Now we know exactly what to do. Get vaccinated, keep gatherings to a minimum, wear an N95 mask, improve ventilation, use tools like rapid testing to high effect, and we can totally avoid a lockdown in most places, I think.
Raywat, when you look at the vaccine passports, as we referenced in saying that when a province or a country brings them in, you see vaccination rates go up, which is great. That's the hope, is that more people get the shot. But can you also draw the linkage in saying by having those in place that transmission out in the community where those are being used is also lower as a result?
Well, we don't have data for that yet, but the hand-waving argument is that we keep the unvaccinated out of super spreading environments like restaurants and gyms and theaters, because that's how COVID is transmitted, in these accentuated explosions of super spreading events. We've known this for months now. So this should work on paper.
Today, as the province has shifted in some of the information that we get every day, with the exception of weekends, we now know of the new cases. There's around 66 of them today. How many of them are unvaccinated? In this case, about 3/4. Today, we're learning that for the first time since they've changed the information that we get, we do have an individual in ICU getting that treatment who is fully vaccinated. And immediately we get texts and questions saying, my goodness, this person is double vaccinated. That is exceedingly rare, isn't it? Even as you look at the ICUs and who's in them across the country itself?
That's right. The protection that vaccination offers against hospitalization is over 90%, over 95% in most cases. The protection against ICU occupancy is even higher than that, but it's not 100%. It's close to it, but not 100%. So if you have enough transmission, the law of large numbers says that eventually a handful of vaccinated people will get sufficiently sick to be hospitalized. But the risk is exceedingly low compared to being unvaccinated.
When you look at our caseload, and we did lift the mask mandate, it felt like for 24 hours. It was a little bit longer than that, but certainly not as long as Alberta and Saskatchewan, and bring back the use of our vaccine passports and our QR codes much more quickly. And now we've been averaging between 40 and 60 cases every day. Can we hope to drive that number lower, or is that just going to be the number that we can expect to see and still keep our economy going? I
totally expect the numbers to come down. The wave, the modeling suggests that it'll come down by the end of October in most places in Canada, if all things go as planned. So it'll come down. It'll come down because there will be sufficient immunity in the population as a result of increased vaccination and of infection and recovery. Those two things alone will drive them down. We might be looking at some level of sustained transmission for the next few months, maybe longer, but that level won't be as high as it is now.
with Raywat Deonandan from the University of Ottawa. Richard and Julie with you on 680 CJOB. Does the flu complicate any of this?
A little bit. We don't want people with flu symptoms, A, entering the hospital system and occupying beds they don't need to occupy, and B, maybe confusing a diagnosis because the symptoms are sometimes similar, but the two co-infections don't seem to be a thing. There is some evidence that maybe the flu vaccine offers some protection against some degree of COVID infection. That's controversial, but there's some evidence for it. But in general, the two are separate diseases and the twain shall never cross.
In wave 1, you talked to us about wave 2. In 2, you said 3 was on the horizon. And during 3, you said 4 would be here. No one has brought up 5.
The reason for that is exactly what I said. I think due to a combination of high rates of vaccination and the fact that Delta, being the beast that it is, will rip through the unvaccinated population and leave in its wake both suffering and immunity, means that there will be no wave 5. There might be some low level of endemic transmission we have to live with, but no waves anymore in like 3, 4, 5 months.
You used that sentence, ripping through the unvaccinated. Wow.
Yeah, that's what it's doing. Yeah. That's sobering, right? People have to take that to heart, that the way you protect yourself and your loved ones is to accept vaccination. Nothing is without risk. The risk of vaccination is not zero. It's just really, really tiny. The risk of COVID is not tiny. It's small, but appreciable. So comparing the two risks, the solution is obvious. You choose vaccination, and the more people that do it, the faster society gets out of this crisis.
When you look at other countries that were ahead of us in their waves, is that proving to be true, that they had a fourth wave and now it's moved to an endemic phase?
A little bit. If you look at the UK, they seem to have leveled off to some extent, but at a high level. And they suffered a very high number of infections during the opening salvos of their fourth wave, probably left in this wake a high amount of population immunity. At a great cost, though. That cost was suffering and death. So this is not a strategy. It's just a side effect of a tragedy. So yeah, if the UK is any indication, we are going down the path of having sufficient population immunity, and we must not open up too quickly like the UK did by having their Freedom Day that created a lot of suffering. We can do this in stages that protects the health of our citizens while at the same time protecting our economy and having an easy runway out of crisis.
Ray Deonandan, always appreciate when you pop on and give us those sobering second thoughts. Thanks for joining us this afternoon.
Thank you very much.
Epidemiologist at the University of Ottawa.